Good afternoon, I'm Riza Diaz. This is One News Now. The Health Department has approved the use of saliva for COVID-19 testing. In today's Laging Handa briefing, Health Undersecretary Rosario Vergeres said the agency's laboratory expert panel has allowed the use of saliva as an alternative specimen in COVID-19 tests. However, only the Philippine Red Cross can conduct saliva-based tests for now, as the DOH awaits validation results from the Research Institute for Tropical Medicine or RITM.
It was agreed by the laboratory experts panel na pwede nang payagan. Pero ang condition po ng lab experts sa mga Philippine Red Cross laboratories muna gagamitin dahil kailangan pa po nating antayin yung resulta naman po ng validation test ng RITM para po magamit ng iba nating laboratorio sa bansa.
The Health Department also expressed support on the easing of age restrictions, noting the need to balance health and economy.
Ang atin lang pong safeguard dyan, kaya naman po ang DOH ay nagkaroon ng positive recommendation because may safeguard tayo na kailangan magko-comply lahat sa minimum public health standards.
Malacanang also backs the IATF decision to lift age restrictions in areas under modified GCQ. Spokesman Harry Roque says allowing children to leave their houses, especially for weekend activities, is rather good for their physical and social mental health. Roque explains that the move forms part of the goal to reopen the economy, but he assures that safeguards and health protocols will be strictly enforced in public places. Now, an expert says the spike in new COVID-19 cases in northern provinces could be evidence that the new UK variant has reached the local population. Speaking with us earlier, UP Octa Group's Nicanor Austriaco said unprecedented surges in Benguet and Cagayan could be attributed to local transmissions of the B117 strain. He also noted that the high positivity rate of 20% in Benguet suggests that the local government is not testing enough its population.
A number of cases that are being captured is actually only a fraction of what is really out there. We are concerned that the growth that you are seeing in the pandemic in certain very hot spots in the northern part of Luzon are actually evidence of the B117 variant in the local population.
Austriaco also stressed that the slight decrease in the country's COVID-19 reproduction rate is still a cause for concern, as it is still above 1. The expert explained that the reproduction number will start to drop only if the country has vaccinated a significant portion of its population. Until then, Austriaco said the government needs to heighten its anti-COVID efforts.
So we do not want that variant to explode here in the Philippines, because that would lead not only to more cases, but tragically it would also lead to more deaths.
And we'll be back with more stories after the break. Keep it here on One News. You're still watching One News Now. I'm Riza Diaz. Officials in Bontoc Mountain Province last night confirmed that 12 cases in the municipality contracted the B117 or UK variant of COVID-19. How is the local government mitigating the spread of this more infectious and possibly deadlier variant? We'll find out as we are joined this afternoon by the operations officer of the Bontoc Municipality in Mountain Province. Ms. Claire Peel is joining us. Ms. Claire, good afternoon.
Yes, good afternoon, ma'am.
Ma'am, magandang hapon po. We'd like to know how are the patients doing so far, and are we seeing any significant difference from those with the UK variant versus of those with or other COVID patients?
Okay. The status of our 12 UK variant patients, 6 of them were already discharged from the hospital. 3 are on home isolation. 2 are still on. 3 are still confined at the Lincora, and 1 of them is still severe.
Ma'am, are there differences on the symptoms that they are showing?
The difference is that the transmission is very quick after exposure. Thus, it can affect the whole household very quickly. And that we also observe that the infection stays quite longer compared to the other COVID patients.
And with that being said, do we have updates on their contacts?
Yes, ma'am. We already conducted intensive contact tracing to their primary contacts, including the secondary contacts of these patients, because some of the primary contacts are already also tested COVID positive.
Ma'am, did we get any information as to perhaps how likely this variant has spread and how these patients have contacted it?
We have received OFW from the UK who came to Bontoc on December 14. While it is true that although he was tested positive of COVID, he tested negative of the variant. However, the close contacts, are all included in the 12 UK variant cases. So as of now, the DOH is still investigating, and we are still waiting for their studies being conducted.
Ma'am, we want to get your insights to perhaps what factors we can attribute the sudden surge of new cases in the province.
For Bontoc, the surge is attributed due to the fact that the virus is more transmissible, and that it added to that, we also conducted intensive contact tracing and aggressive testing. Thus, cases start to rise.
Well, you mentioned these are measures that the LGU is taking to stem the spread of the variant. Would you heed to the recommendation, ma'am, of the Department of Health to implement perhaps 2 more weeks of lockdown?
As of now, ma'am, the area or the barangay where the variants are already on 14-day lockdown. The mayor will be issuing today the extension of the lockdown of the other 3 central barangays. So all these 4 central barangays will have a 14-day lockdown. Aside from the imposition of localized lockdown, the LGU also conducted efficient contact tracing and mandatory testing of known contacts. This way, we knew who were really infected in the area, and then we also intensified our policies and its implementation in partnership with our local PNP and barangay officials, to minimize especially gatherings and movements of our people, because considering the characteristics of this virus, movement should be movement should be minimized so that the transmission will be broken, or the chain of transmission will be broken.
Right,
Added to that, there are also instances where we issue notice of violations to those who violate the quarantine, isolation, and testing.
All right, thank you for your insights and for your time, Ms. Claire Peel, Bontoc Operations Officer. Now, over in Davao City, the local government will fully implement the mandatory use of COVID-19 QR code in all establishments starting February 3. Let's get more details on this. We have Gemma Vansenia reporting to us live from Davao City. Gem, can you tell us the latest? Gem? We'll circle in back to Gem in a few moments. Gem, we'd like to know more about this implementation of mandatory using the QR code in Davao City. Can you tell us more about it, please?
Yes, in an executive order, Davao City Mayor Sara Duterte stated that based on the pilot testing, the system can now function for the purpose it was developed. Thus, mandatory implementation of its use across the city can now proceed. The Safe Davao QR code will be used for efficient contact tracing for possible COVID-19 infected individuals. Those entering business premises are required to present their QR codes for scanning. Establishments are also required to scan the QR code of those who are exiting the area to determine the period a certain individual stays inside. The policy, however, attempts offices or establishments that are not enclosed. These include ambulant vendors, milk tea stalls, bake shops, sari-sari stores, and palengke. Riza latest data from Safe Davao QR code website shows the 2.1 million individuals and 77,000 establishments already acquired QR codes. This comes as 80 new COVID-19 cases were recorded here in Davao City yesterday, bringing the total number of COVID-19 cases here in the city to more than 10,800. Riza?
Thank you. That was Gem Avansenya reporting live from Davao City. And for more updates, visit News 5, the Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.